Today's topic is gunshot wounds. Gunshot wounds are a medical emergency. The extent of injuries depends on factors like where the person was shot, the type of gun, and the size of the bullets. If someone gets shot, it is critical to call your local emergency service as soon as possible. While waiting for the ambulance to arrive, administering first aid can save the person's life. First aid can help slow bleeding and prevent life-threatening complications. First aid for a gunshot wound. People experience non-fatal gunshot wounds more than fatal ones. It's important to identify where the person has been shot and begin first aid before emergency services arrive. The first 10 minutes of the injury are called platinum. Bleeding is the leading cause of death in gunshot wounds. The faster a person gets to the hospital, the better their chances of survival. Medical attention should be received within the platinum. While waiting, check if the person is awake and responsive. This is the tap, shout, tap method, which involves asking the person questions like, "Can you hear me?" followed by a form of tap and another verbal cue. You should try this for 10 seconds or fewer. If the person is not breathing and unresponsive, you can perform CPR or use an automated external defibrillator if available. Managing bleeding. If the person is bleeding profusely, it is important to apply pressure to the wound. It may also be necessary to use a tourniquet to limit the loss of blood. If the person is responsive, try to collect as much information from them as you can. Ask about the way they are feeling and the allergies or medical conditions they may have. Recovery. Recovery from a gunshot wound is different for every different case. People with minor wounds heal in weeks, while others may experience permanent disabilities. Surviving a shooting is usually traumatizing for most people. They may experience panic attacks, anxiety, or depression, and might need mental and emotional care. Talking might help survivors process their emotions and thoughts, and also develop coping strategies. If the wounds are severe, the survivor will have to work with a team of healthcare professionals. Outlook. Gunshot wounds require immediate medical attention. First aid starts with getting the injured person and yourself to safety. Then call local emergency services. Many types of surgeries and medical treatments are used to treat gunshot wounds. Recovering may require staying in the hospital for days, weeks, or longer. After discharge, the person may need medication, physical therapy, and in some cases, further surgery. Overall recovery from a gunshot wound varies depending on the location and the severity of the injuries. A doctor or healthcare team will work to create a recovery plan and what to expect at each stage.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.